Do you know the signs of a fatty liver? This question might seem a bit unusual, but let's take a moment to consider it. Our liver, a powerhouse organ tucked away in the right upper quadrant of our abdomen, carries out over 500 vital functions. Unfortunately, it's not invincible. One of the most common conditions it can fall prey to is fatty liver disease. Fatty liver disease, as the name suggests, is characterized by an excess accumulation of fat in the liver cells. This condition can be triggered by a variety of factors, but the most common culprits are excessive alcohol consumption and obesity. Although it might start as a benign condition, without proper care and attention, it can escalate to severe liver damage. Now you might be wondering, why should we concern ourselves with fatty liver disease? The answer is simple. Early detection can make a significant difference. The initial stages of fatty liver disease are often reversible. With the right lifestyle changes and medical interventions, one can prevent the progression of the disease and protect the liver from further damage. But here's the catch. Fatty liver disease is often termed as a silent killer. Why? Because it's notorious for showing little to no symptoms until it has advanced to a more severe stage. This is where our discussion becomes crucial. Over the next few minutes, we'll be exploring the 7 signs that could indicate the presence of fatty liver disease. From fatigue to stomach pain, excess gas to jaundice, and even seemingly unrelated symptoms like night blindness and white nails, we'll delve into each of these signs in detail, helping you understand the potential red flags your body might be throwing at you. Remember, knowledge is power. The more you know about these signs, the better equipped you'll be to listen to your body and seek timely medical help if needed. So, are you ready to embark on this journey of understanding and awareness? 1. Fatigue is the first sign of a fatty liver. It's a familiar feeling, isn't it? That bone-deep tiredness that no amount of sleep seems to cure. Often dismissed as lack of sleep or overworking, persistent fatigue can be a red flag for something more serious, like a fatty liver. When your liver is clogged with fat, it struggles to perform its vital functions, one of which is to filter toxins out of your bloodstream. These toxins can build up, leading to oxidative stress and inflammation. Your body responds by diverting energy to fight this inflammation, leaving you feeling constantly tired even after a good night's sleep. Fatigue is your body's way of sounding the alarm, signaling that your liver is under stress and needs help. It's a subtle sign, easy to overlook but crucial to heed. The next sign may be more familiar to you. 2. Stomach pain and bloating. Ever experienced that? These discomforts may be more than just your body's response to a heavy meal. They could be signs of a condition called fatty liver. Fatty liver disease occurs when excess fat builds up in the liver cells, causing inflammation and damage. Now you may wonder how stomach pain and bloating fit into this. Well, the liver, being a key player in digestion when affected, can disrupt this process. This disruption can lead to an uncomfortable buildup of gas, causing your stomach to bloat and ache. It's like a traffic jam in your digestive highway. Also, the liver's location in the upper right quadrant of your abdomen means that any discomfort it causes is often felt in the stomach area. So if you're experiencing persistent stomach pain and bloating, it's worth considering a chat with your healthcare provider. Moving on to the 3rd sign. 3. Let's talk about excess gas. When we say excess gas, we're referring to a situation where your body produces more gas than usual. This can lead to uncomfortable bloating and frequent burping or flatulence. But did you know that this could be a sign of a fatty liver? When your liver is laden with fat, it struggles to perform its duties, one of which is to aid digestion. This struggle can result in malabsorption of nutrients, leading to fermentation in the gut and the production of excess gas. It's important to note that while everyone experiences gas, consistent excessive gas could be a signal that your liver is crying out for help. Remember, your liver is an essential organ for your body's well-being. Just like a car engine, it needs to be in optimal condition to keep the body running smoothly. So, don't ignore these signs. Now let's discuss a sign that can be quite alarming. 4. White nails. Ever noticed them? Now, we're not talking about the occasional white fleck or line that can appear due to minor injuries to the nail bed. What we're referring to here is a condition known as Terry's nails, where the majority of the nail plate turns white with a narrow pink band at the top. You see, your body is a complex network of signals, and sometimes changes in one area can indicate issues elsewhere. When the liver isn't functioning properly, it can impact the flow of nutrients needed for healthy nail growth. This can result in nails appearing white, dull, or even opaque. It's important to remember, however, that white nails can also be a sign of other conditions such as kidney disease, diabetes, or malnutrition. So while it's a sign to pay attention to, it's not a definitive diagnosis. Always consult with a healthcare professional if you notice any significant changes in your body. Lastly, let's talk about the final sign. 5. Swelling in the legs and ankles, a sign not to be ignored. This symptom may seem common, especially after a long day on your feet, but persistent swelling could indicate a more serious underlying issue, such as fatty liver disease. This condition, medically known as edema, happens when fluid accumulates in your tissues. It's not just about discomfort or aesthetics, it's a sign your liver isn't doing its job properly. You see, a healthy liver produces a protein called albumin, which helps keep fluid in the bloodstream. However, when the liver is damaged or inflamed due to the excess fat, it can't produce enough albumin. As a result, fluid leaks out of the blood vessels and pools in the lower parts of your body, causing swelling. So, if you notice persistent swelling in your legs or ankles, don't shrug it off as simple tiredness. It's worth discussing with your healthcare provider. 6. Itching all over the body, a sign not to be ignored. You might have experienced itching all over your body due to an allergic reaction or a bug bite, but persistent itching could indicate a more serious underlying issue, such as fatty liver disease. When the liver is not functioning properly due to damage or inflammation, it can lead to an accumulation of bile salts under the skin. These salts, which are normally processed and eliminated by a healthy liver, can cause itching all over the body when they build up. This itching isn't just a minor annoyance, it's a sign that your liver isn't effectively processing toxins due to the excess fat. The more fat that accumulates in your liver, the harder it becomes for it to perform its detoxification role, leading to symptoms like this. So, if you notice persistent itching that doesn't seem to be linked to a common cause like allergies or bug bites, it's worth bringing up with your healthcare provider. Now let's move on to the next sign. 7. Red spots all over the body, a sign not to be ignored. Ever noticed persistent red spots appearing on your skin, especially on the torso and face? They might not just be a result of allergies or skin irritation. These spots, also known as spider angiomas, could be an indication of a serious underlying issue like fatty liver disease. Spider angiomas are small, spider-like capillaries visible beneath the skin. They can be caused by an imbalance of hormones due to liver disease. When the liver is burdened with excess fat, it becomes less efficient at its detoxification role, which can lead to hormonal imbalances and cause these spider angiomas to appear. So if you notice persistent red spots that don't seem to be linked to common skin issues, it's worth noting and bringing up with your healthcare provider. Now let's move on to the next sign. Recognizing these signs can be an early warning system for a fatty liver. As we draw this journey to a close, we've embarked on an exploration of 7 distinct signs that could signify the presence of a fatty liver. These can range from symptoms that are easy to overlook, like the fatigue that could simply be attributed to a hard day, to more distinct signs like the manifestation of white nails or swelling in your legs and ankles. These signs are not designed to frighten you, but to arm you with vital knowledge that could ultimately be a lifesaver. We've considered how enduring stomach pain or bloating, even excessive gas, might be your body's way of communicating with you. Dismissing these symptoms as something caused by overeating or stress can be tempting, but appreciating your body's subtle warnings could be the difference between early intervention and substantial health issues. We've also exposed some of the lesser-known signs of a fatty liver, such as the emergence of red spots throughout your body, the appearance of spider veins, or even a condition known as gynecomastia. We've investigated palmar erythema, a reddening of the palms, and even night blindness. These signs, as unrelated as they may appear, could be your body's SOS, a problem with your liver. Even your body's waste elimination processes, like the color of your stool or urine, reveal useful insights. Pallid stool and dark urine might not just be a reaction to your diet, but could be your body flagging a liver laboring under a surplus of fat. Jaundice, a yellowing of the skin and eyes, and body-wide itching are symptoms that unequivocally should not be overlooked. So if you experience a loss of appetite or ongoing nausea, it's time to heed your body's call and seek medical advice. Remember, knowledge is power. Grasping these 7 isn't about self-diagnosis, but about being vigilant and proactive about your health. It's about identifying when something could be off-kilter and knowing when to seek the help of a healthcare professional. Remember, the power to safeguard your health is in your hands. If you notice these signs, don't hesitate to consult a healthcare professional.